My left hand actually was the worst one.
I had been wearing wrist braces for years because of the pain that I was experiencing.
It gave me the most pain and would wake me up in the middle of the night.
So the reason why I was having the tingling in my fingers was that was a sign of nerve damage.
Carpal tunnel syndrome affects more than 8 million Americans each year. It's a condition in which the structures inside the wrist tunnel, or carpal tunnel, get squeezed, causing pain, weakness, or numbness in the hand and wrist.
There's 10 structures in the wrist tunnel itself, one of which is the major nerve that goes to the hand. And when that nerve gets squeezed, then there's loss of blood flow to that nerve, in which case you get numbness and tingling in the fingers, you get pain in the wrist, you can get pain in the hand, you can get radiation of that pain up and down the forearm.
No one knows what causes carpal tunnel syndrome. Women are 3 times more likely than men to develop it, possibly because the tunnel itself is smaller in women. Certain conditions may predispose some people to carpal tunnel syndrome, including diabetes, pregnancy, thyroid conditions, and rheumatoid arthritis.
There's a lot of talk about whether or not typing itself is linked to carpal tunnel. There's no direct correlation there. There probably is a correlation, though, that typing in somebody who's predisposed to carpal tunnel actually makes it worse. There's also some studies that demonstrate that people, construction workers who use a lot of vibration tools, will get carpal tunnel.
Yeah. Wrist splints, physical therapy, and pain medications can provide some relief. But when the pain progresses, surgery may be necessary. Dr. Charles Day, the chief orthopedic hand surgeon at Beth Israel Deaconess Medical Center, was the first in Boston to use a new, minimally invasive surgical procedure to treat carpal tunnel. It's called the Mirza single portal endoscopic tunnel release. Unlike traditional surgery, where a 3-centimeter incision is made at the base of the hand, the Mirza technique involves a smaller incision of about 1.5 centimeters into the center of the palm.
So the benefits for the patients is multiple-fold. Number one, they have a smaller incision. For most patients, the smaller scar, the better. The second thing is the location of the incision. The incision is not in the base of the palm, and so it's not where you rest your hand. And so it doesn't take the direct impact, and so it's a little less sensitive, and it's a little quicker healing.
The surgeon uses an endoscope, or tiny camera, to see an inside view of the wrist tunnel. The carpal ligament is located and released using tiny surgical tools, enlarging the carpal tunnel and eliminating the squeezing that caused the pain. Most procedures are completed in about 20 minutes. Stitches are applied and the hand is wrapped in a soft dressing, which is removed 7 to 10 days following surgery. But patients can go back to many activities immediately following the procedure.
So they're moving their fingers immediately, and so they can do anything with respect to just using their fingertips. They can hold a steering wheel with their fingertips, they can hold a toothbrush, they can hold a knife, they can hold a fork. They can type immediately. I feel that this system has worked very well for my patients.
Because patients have less pain, they also take fewer pain medications, so they are more alert and functional.
I didn't lose 1 day of work with the procedure, and not only that, but there was no pain after, even in the recovery period.
I can't say enough positive about it. The pain, the numbness, the tingling in my right hand is gone. I can throw my braces away.